It's very superficial, and it's usually about 15 units in each side. So this syringe has a 30 units. So it's about half the syringe goes here, and the other half goes on the other side. That little bleb that forms, it's so that it stays very superficial. In about half an hour, it'll go away. And so here, depending on how the patient has the lines, and some patients like to raise their eyebrows up, so we injected a little different. Dawn told me that she didn't want her eyebrows up, so we basically inject the Botox throughout the whole area on the forehead. Otherwise, we sometimes skip that middle part. So after the Botox, what you need to do is you need to move the muscles so that the medication goes to the location. In other words, I need you to smile, raise your eyebrows up, and frown. About 1 or 2 minutes every 2 or 3 hours during the next 2 to 3 hours. Don't rub the area. Don't start rubbing it, because then you'll move it.
Oh, okay.
And you can exercise, but I don't want you doing like yoga where you have to put your head below your knees. You can do weights, you can do a little bit of legs, but don't start doing the yoga type of exercises. The Botox, we're gonna see the results next week.
Okay.
If you need any type of touch-up, then you just come in and I'll do it as part of this treatment. So you may have gotten the dark spots from pregnancy, but maybe also from the sun exposure. The other reason why we sometimes see it, like if you've had an acne spot that explodes or you pick at, you can stay with what we call post-inflammatory hyperpigmentation, which is just darkening of the skin. But 95% of the time I can clear this for you, but it's not only with one product. You need several products. And it's important that you use them the way I tell you, because I make some of them and they're very strong. So what I usually do is have you, and I have it all written down in the front before you leave, they're gonna give you a card, and the secretary is gonna go over with you how to use it. But basically what you need to do is you need to wash your skin, and we usually recommend the glycolic acids because they'll take off all the oil, so the medicines come in easier. Then you put the fading lotion. Now the fading lotion, but you have to use a small amount, otherwise you will get irritated. Basically what you need to do is you need to apply, let the liquid go into the sponge and apply a small amount, like that much for your whole face. Mainly at the beginning, make sure it's wet, and then just apply one dot, okay? And then with your fingers, go like that, okay? Okay, you do that in the morning and at night.